Come on, Andrew. Come on, Doc. We're waiting for you.
Like
Oh
trying
my
to get
God.
everybody squared away was a little bit
So
delayed, so I
I'm
apologize.
sure you're missing your patients as much as I am, aren't you?
Absolutely.
I
What's
know it,
amazing though, virtual,
amount
the
of
ability.
support that they
Uh,
give is, I mean, I was sick, but even now that I'm healthy again, just people showing their enthusiasm to come back.
yeah,
We're part of their lives. You know what I
yeah,
mean? And I
yeah,
really do miss them.
yeah. I miss them so much, and what's amazing too is that, just like you, I have a global practice, so I've been on the phone, on the video conferencing with people from all over the world, and
Yes.
what's really amazing right now is that everybody in the world is experiencing this at the same time.
Yes,
It's
yes, yes.
there are tragedies and there are horrible things that happen in the world, and they happen to one group or another, one country or another. Right now, everybody, I'm talking to patients from Istanbul and Lebanon and from Australia, everybody's experiencing this at the same time.
Yeah,
So
yeah, yeah.
it's
Yeah.
an amazing time, really.
And what's great, at first when this all started happening and people were reaching out, like, I can't wait to come from Dubai when I come to New York to get my treatment, all these things. At first I was like, God, how could people think of these type of things, as flattered as I was, during this time? But I think forget about the cosmetic aspect. It really shows the human nature to want to interact and be happy. And it just shows me COVID's not going to defeat that. And whether it's getting facial plastic surgery or wanting to go to your local deli, it just shows that people want to go on and continue their life.
Yeah, well, I think that's the whole thing is that, at the end of the day, we still one of the most important things about being human is having pride in our appearance.
Yeah,
That's reality.
yeah,
And even though we're going through all this, we still have our lives. We still are thinking about things, and we're still wanting to be our best selves at the end of the day.
yes,
I mean, I know I've been
yeah,
exercising more now than I
yeah.
usually do in my normal life. So
I
like
don't know about that.
yeah, yeah,
I don't
I
know.
don't know. I'm telling you, we're still, we want to improve ourselves. We want to improve our health. We want to
Yeah,
improve our appearance. We're
yeah,
eating better. Like we're doing these things that we don't usually have time or pause to do. And it's
yeah,
horrible that it's happening within this context. But I think it's giving
yeah,
us an ability to kind
yeah.
of retune the lens and looking at things from a different perspective.
I do believe there's going to be a huge liposuction burst for me in 6 months,
Yeah, no.
though. And from the look of those like tomahawks you were cooking or whatever those
Listen,
were, the
I only
cowboy
had a little
steaks.
bit. I was cooking for six
Ooh,
people. Okay.
those look good. I mean, there's a lot of food porn going on the internet right now.
Something like
All
that.
right.
Well,
I know you're very academic. You write a lot of things in textbooks, and I know one of the things you get pleasure from is traveling around the world, teaching other physicians and doing that. That's going to change, right? How do you
oh,
think
massive!
that,
It's changed so much already. But
and the
even all the
philanthropic work,
yeah,
that you do?
yeah. I had a mission trip planned for September that we had a delay where we do cleft surgery on children.
Yeah,
And the thing is that most conferences, I'm sure you've experienced this
yeah,
even in your world, and almost all conferences for the next 6 to 9 months have been canceled and
yeah,
rescheduled for a year ahead.
yeah,
So there's going to be a lot less of that. Plus, I have a lot of surgeons who come visit me, and they're in the operating room, observing the techniques that I do. And we pretty much just told everybody that we don't know when we're going to allow that to happen again, because at the end of the day, really what we're trying to do is protect our patients, right?
yeah,
So whether I'm traveling, you're traveling, or people traveling into our world from other places, we have to be very, very careful about how we're exposing our staff, ourselves,
yeah,
and our
yeah.
patients. Yeah.
And I think there's going to be, even though it'll be really bad for the next 9 months, it will have a permanent impact. I mean, I would have a same thing. I have residents that come through my office,
Yeah.
people, there is a kind of a laissez-faire communal attitude.
Yeah.
I mean, even as a teacher, you learn a lot from students. You know what I'm
Yeah,
saying?
of course. Well, that's the beauty. It's the exchange, right? So you
Is it,
teach, they ask questions, you rethink what you're doing, people
yeah,
present other ideas. That's the beauty, and that's where things evolve and learning
yeah.
happen. Yeah.
So, you're not going to be traveling that much, I don't think, huh?
No, listen, I'm locked
Yeah.
down. I'm locked
Yeah.
down. I'm not moving.
Yeah. Now, you're unique because you really, I think, we all share common patients and all these things, but your rollout may be a little bit different than mine. I know my patients will probably do less invasive things first.
Yeah.
Do you think, are there certain things you feel more comfortable to do at first, or in terms of
Yeah.
severity of surgeries? Tell me.
Yeah, I mean, well, I mean, all of it is concerning, right? Because we're in the
Yeah.
middle of this whole thing, and I don't think that any of it should be taken lightly. At the end of the day, I think that you have to be able to function in a way that's going to be protective. So we're already establishing protocols to do that. But in terms of the procedures that we're going to do, I'm going to try to avoid things that have to do with the airway more. So things like rhinoplasty
Yes.
or
Yeah.
airway stuff, where, either that or we're going to have testing. So, right. So the thing is that we're obviously working on trying to get rapid antigen testing to be able to see real time. That's the way to really protect patients and staff, is to make sure that everybody's tested, not only
Yeah.
the staff, but the patients. And that
Yeah.
way you can have more confidence going ahead that everybody's going to be okay.
Yeah. I honestly think moving forward, a doctor's office, especially ones like ours that are surgically accredited, we have RNs, we have
Yeah.
highly trained staff and universal precautions.
Yeah.
You got to understand, like, people, even when they go to restaurants, most restaurant workers, they're going to learn basic things, but they're not going to be like trained like doctors and nurses. I think our places are going to be pretty safe.
Yeah. I mean, I know that we're going to pretty much function as if the first thing is that we're not going to have a mass of people, right? So when
Yeah.
we treat people, people are going to be coming in individually. They're not going to be multiple patients that are being treated at the same time.
Yeah.
So there's going to be less ability to communicate that way. But we're really going to be functioning like everybody has it, like universal precautions, like you said. It's going to be a new world. But until we have more clarity and immunity and a vaccine, I think we're going to have to treat everybody as if they have it. In other
Yeah.
words, we're going to have to
Absolutely.
protect. We're going to have to protect everybody. So you can still have things done safely, but you need to use universal precautions. So we're going to be gowned up, we're going to be suited up, and we're going to be protecting ourselves, and we're going to be protecting our patients and our staff. It's just a smart way to do it. We can't go back to business as usual. It is not going to be any way similar to the way we're normally functioning for a significant period of time, I think.
It may save me a lot of money on the nice suits I like to wear if I'm just going
Yeah,
to be in like a gown and a scrub.
all right.
I'm going to have a lot less Insta-shot opportunities.
It is. Listen,
I won't look as good with like
yeah,
the mask and.
I don't know. I find it hard that you could ever not look good. That's the thing.
Oh, thank you.
That's true. I aspire to be you. I need
Do you
Botox.
think?
We talked about that. Yeah, I got to come in. I need some Botox, bro.
Yeah,
Help
don't
me.
worry. I'm getting my long list of things I need after this. COVID does something to the whole
I can't even
elasticity
imagine.
issue.
Yeah.
In terms, I know you do some procedures under local anesthesia, meaning like, just like local, right?
Yeah.
You don't put everyone under intubation and asleep, right?
Yeah, well, we don't intubate. We really don't intubate most of our patients. We do
Okay.
almost all patients under twilight sedation, which is
Okay.
IV sedation.
Yeah.
So it's very rare for me to intubate patients. The reason for that is that it just makes people feel sick. And if
Yeah.
you have skilled anesthesiologists who can perform sedation, you don't have to intubate them. And patients just don't wake up nauseous. They don't have that hangover they normally get.
Yeah.
It's just, and I think it's safer at the end of the day.
That's
But beyond
amazing.
that, yeah. But
So
we do local.
the majority of and I want you to explain your technique, the
Sure.
deep plane, you do under local or IV sedation without with
All patients, yeah.
that's unbelievable. If you can give like a layman's explanation of what the deep plane facelift is compared to like maybe things of facelifts of yesteryear.
Yeah, well, I mean, so there's a pretty simple way to explain it. So the more traditional facelift of yesteryear, even done today by the majority of surgeons, literally, probably over 90%, is a procedure called a SMAS facelift. So what they do is the SMAS muscle lives in the lower third of your face, kind of here. So it doesn't really live in this part of your face. So what they do is they peel the skin back to here, and then they lift or tighten the muscle in the lower third of the face to tighten the jowls. But they pull back towards the ears, so the corners of the mouth kind of get spread a little bit. And that's what people are afraid of, that kind of tight, really tight jawline, kind of stretched mouth, pulled corner of the eye look.
By the way, years later on those patients, I have to do so much volume restoration
on
because
the
they
on the
lose the
jaw
adipose.
on the posterior jawline, because they literally get crushed in this area.
Yeah.
So what deep plane surgery does is it doesn't peel the skin away from the deep layers at all. It leaves the skin, the fat layers, and the muscle all attached as one unit, and it lifts the entire face from here to here. So what happens is that you have this thick padding of tissue instead of that surface tightening, and then all of it gets lifted vertically. Instead of getting this look, you get a hard shape back, because all of that deep stuff that kind of falls here, I do this, I'm 50, for God's sakes, it sucks.
Yeah.
But when you fall forward, you see all this junk, you get under that and you move it up instead of just pulling these muscles and tissues back to the ear. So that's the look that everybody's afraid of, but the deep planes don't do that, because we're not working in the same layers. It's under the deeper fat and the deeper muscles, and it's lifted this way against gravity, not pulled back towards your ears.
Right.
So we don't live in a horizontal, gravitational field, but everybody's pulling people in an anti-gravitational kind of way, which is just weird. So that's why people look weird.
You also tend to you do things on the temple as well when you're doing
Yeah.
that. Are
Yeah,
you
we do.
moving tissue in the same manner?
Yeah, for sure. So when we do, for a lot of patients, and I'm one of them, right? Because this is falling. I, gotta get. That's why I get to see you, bro. You gotta help me.
I can't
So
do surgery on myself either.
I make an incision on here, a tiny little incision. I go down and I lift the lateral third of the brow. It's called a lateral temporal lift. It's not a brow lift because this makes people look like freaks, right? You go like this and you're like, what the hell happened?
Yeah.
But when you lift the lateral tail of the brow, and that's what Botox does well too, right?
Yeah.
If you can lift this vertically and this, what happens is we get that more youthful look because it's not up or pulled in weird
What if
directions.
someone
It's in the right
needs
direction.
that though?
But some people do. So when people need that more, and it depends on the age, right? So a lot of patients that we see that are later 40s and early 50s don't need as much, but as you get to be closer to 60, you get more of that heaviness here. But here's the thing. If you do the release from out here and lift this up, the center will come up a little bit with it. But if you have somebody who has a lot of drooping here, you have to make additional incisions to help lift that center part. But it's much less likely that's necessary. But that's what happens. People get lifted here and the corner of the brow doesn't, and it gives you that very surprised look because the corners are down and the center is up. Yeah. We want the corners up.
And then someone's asking, how long is the recovery? 1 to 2 weeks? 2 weeks?
Yeah, it's usually, I mean, I tell people to expect 2 weeks on the longer end, but usually, we use hyperbarics, and we talked about this. You and I both use hyperbarics. Yeah, we love it. So what happens is that, if you put somebody in a hyperbaric oxygen chamber every day for the first week after surgery, they literally recover within usually about 7 to 10 days. So most people will get back to work. I do a lot of people, obviously like you, who are attorneys or physicians or in finance. They can't take 3 weeks off to recover. So I get them back to work within usually a week and a half.
I mean, that's really amazing. What would you say? I'm sure this has changed over the last 10 years. What would you say the average age is?
I would tell you right now, it's 47. I know that because I study it. So I think the reason why that is not because people necessarily need it so much, but I think that we're all holding the bar for our appearance higher and higher.
Absolutely.
And the thing is like, most of your patients, I'm sure, and I don't do injectables really anymore. It's been years. But the reality is people come in, they start coming in their late 20s, early 30s, mid 30s. They want to maintain. They really want the best version of themselves. They don't want to look good. They want to look absolutely fabulous. And the thing is as you get to be in your later 40s and you've been doing the non-surgical treatments, a lot of people want that next big pop. And sometimes it can just be the number. When people are 49 turning 50, they freak out a lot because it's like, I'm going to be 50. Let's like reset the whole thing. And that's
well, I can tell you, at least in my practice, it's very, and I can tell you even from my own personal experience, I'm now 50, that gets to a point, it varies, but it usually starts in the mid 40s to 50, where the non-invasives tend to be a little bit of a law of decreasing returns. And you can go 2 ways. You can learn 3 ways. You can learn to live with it, that you're aging and you can't have the results from Botox and filler you had at 35 or 40. You could go see someone like Dr. Jacono, or you can do what unfortunately some people do, is just overdo it.
That's the problem.
You need the facelift 5 years later, even more.
Yeah, but here's the biggest problem is that, it takes skilled practitioners to know in all realms, whether it's surgery or non-surgical, there are things that surgery cannot do. But you need to be able to be respectful of that and know when other referrals are necessary to be able to accomplish the goals. Similarly, you have to know when the non-surgical stuff, you've hit a wall. And to do too much of it starts to cause distortion. So bad surgery causes distortion, and excessive non-surgical treatments cause distortion. Too much of anything is not good, right? It's not more is more, more is better.
Absolutely.
It's the right amount that's better. That's the problem.
And you know what a lot of people don't realize, my patients do, as I do I'm so sure yours, is that just because you go and get your face done doesn't mean you will never need injectables again or peels or something.
Of course not. That's insane.
But some people do. Some surgeons say, "Oh, you're going to be fine. It won't do anything." And I have a lot of patients that come back 6 months after the most amazing surgery, and they're like, "Dr. Such and Such did a great job, but I feel like it made this worse." I said it didn't make it worse. It's relative. They painted 3 walls. Now we got to do a little filler or resurfacing.
Well, it's unmasking the other problems that weren't they weren't the leading problems. But now that there's an old saying, my nurse Harriet in my office, she's my head nurse in the OR. She goes, when you clean the floors, the walls look dirty. This is what happens. You're cleaning up everything else around. That's what I say. And then you wind up seeing the things that weren't so obvious, but now in relation, they're much worse. So it's a coordinated approach to beauty. multiple levels of treatments, different modalities, different practitioners. This is how you really, this is how you hold the bar up here. That's how
Yeah.
it happens.
And this is why I say, to the audience out there, you have to realize, listen, if you're aesthetically concerned and you're in the game and you're in the fight, you want to be the best version of yourself, there's never going to be a best treatment. It's not this
No.
or this. And whether you have a facialist and a cosmetic derm or someone you've done surgical stuff with,
Yeah.
you want to do it with people who have a respectful communication and respect for the other people involved.
Of
Because you
course.
get these plastic surgeons who are like, derms don't do shit. And there are
Yeah.
derms that are like, you'll never need plastic
Plus,
surgery.
well,
And it's
what's so
ridiculous.
goofy? There are derms, or plastic surgeons who are trying to function in the exclusion of each other when we need each other. It's goofy.
Exactly. Exactly.
It's absolutely insane. For people, like you said, to blow somebody's face up so it's distorted and out of
I know.
proportion to avoid sending them for a surgical referral is crazy.
I know.
And for somebody to over-surgerize somebody when they need things like volume and other treatments that you can't accomplish with all surgical approaches is similarly silly. But this is the difference between average practice and evolved practice.
Yeah.
This is
And I know,
this is the
listen,
difference.
there are so many plastic surgeons that do equal amount injections and lasers as they do surgery. And there are many dermatologists that are trying to do smash lifts.
Yeah.
And they're doing tons of blephs and all these things.
Yeah.
And I'm like, I say to my patients, okay, you want to go to somebody who does a lot of the same thing over and over.
Whatever it is that you do. Exactly.
You know what I mean? And if you're spreading yourself out so thin, I like to work with providers that's what they do all the time.
Well, of course. And it's like me, I only do faces. So, I don't do any body work. But when I refer out for body, I only send to people who work specifically on that part of the body regularly. So I'm not sending the person, I'm not sending to the guy who does like, tummies, breasts, this, that, and every other thing he get his hands on. I'm sending to the breast guy. He does more breasts than anybody else. He knows the nuances. Because here's the thing. The more you do of anything, the nuances, the subtleties, the aesthetic awareness, it all grows. That's just it's part of any business. It doesn't make a difference what you do. You can make desks for a living. You can do plastic surgery. If all you do is make desks and you've done 10,000 of them versus the guy who make any other kind of furniture in your house, the guy who only makes desks is going to make a more beautiful desk. It just is what it is.
You mentioned when we were speaking on the phone, do you work with Adam a lot?
Yeah, Adam Coker is fantastic.
Dr. Coker? Yeah, I work with him. He's an amazing breast surgeon, body surgeon.
Amazing breast surgeon. But, he's not the only one I work with. But, of course, but the thing is, though, and then you find out there are people who have certain niches, too, for revision work or other things. And, everybody has their thing. They have their skill set and their specialty.
And, by the way, it's different personalities. Also, there really is. I mean, I tell people, you have to share the energy.
Yeah.
I'm not everyone's cup of tea. I don't expect to be. And I wouldn't expect that from surgeons.
Yeah. And I say it to my patients all the time. They say, well, why should I choose you over another person? I said, well, here's the thing. There's lots of qualified guys out there. I'm not the only guy, obviously. But, this is a relationship at the end of the day. And the thing is that it's not just about the technique and the procedure, which is important, of course. But at the end of the day, this is a person that you have to have trust in. This is somebody you have to be able to communicate with. Going through treatments, it is a process, and you need to have somebody who's part of your team, somebody you can relate to, because you could have the most amazing treatment, but then if you don't have somebody to support you in the front of the back end of it, it could be a disastrous outcome and a disastrous situation for you.
A lot of people don't realize, because obviously I see an enormous amount of surgical work, yours included, that even though you look good in 2 weeks, it takes time. Everything takes time. It's like Botox kicks in 3-4 days, but it takes weeks to really see the final result.
Yeah, to see what it really looks like.
It is a relationship. It's not a one and done thing.
Yeah, I mean, I see my patients for like literally, I because I do so much research and publish so much, I see my patients for years afterwards because I want to document and quantify and study what's happening. So the thing is that, I'm seeing these people forever. I mean, they become like members of my family, and I love it, and it's funny because, what's great about having a global practice too is like when you're in another country, you can just call up a patient and go out to have a cup of coffee and like get to see the best parts of Istanbul or the best parts of, of whatever country that you happen to find yourself in, which is a lot of fun too.
For me, I don't know about for you, maybe if you have the number on the top of your head, I would say 15 to 20% of my practice are people that don't live in the New York tri-state area, maybe 20%. California, international, Mid-East, European Union. I mean, it's just unbelievable. And you know what? I'm I know, even though I'm very confident my practice is going to come back and it's be great, I'm a little sad that it's going to take a little longer to
Yeah,
see those people.
that's gonna take more time for people to feel comfortable with that for sure.
You know, it
Yeah.
really will,
Yeah,
because
but but this is one wonderful thing that I think that that we all have to continue to focus on is that, we're going to get through this. This is temporary. We got to do the best things we can,
yeah,
and what we do. We want to be safe. We want to be careful. And, this is going to be, at the end of the day, as horrible as this is, I think there's going to be a lot of positive things that'll come out of it.
absolutely,
Like,
absolutely.
and I sincerely believe that. I don't
Yeah.
want anybody to be going through all the pain and suffering you're
No,
going
no,
through.
no, no.
But
I
when
agree.
these things happen, they help evolve our consciousness, and they really make us think about who we are, what we do, what's important to us, what we're
Yeah,
passionate about, how we can do things better, how we can make the world a better place. I mean,
yeah,
I know that I feel motivated to do everything that I can when I can to be supportive of everybody in any way that I can
yeah.
when it comes to this
Absolutely,
crisis.
absolutely. Someone was asking about, do you do, and then I want to talk about lip lifts for 1 second. Do you
Yeah.
do buccal fat pad removal?
Yeah, of course. It's a routine procedure, and it's usually done. I
Some
don't do
people
a,
don't like doing it.
Yeah, yeah. Well, this is the thing. It's like a matter of degree, and I always talk to them because people are afraid of removing buccal fat. I don't do a lot of it, and I don't do a lot of it in young people. But as people get older, their buccal fat pads become enlarged. It gives you a little bit more of a jelly or pudgy look in the face, even though you may be thin. So you don't remove the whole buccal fat pad. So it's like a nose job, right? So if somebody has a bump in the nose, like I do, I got a big honker here. But when you have a big honker, you don't take the whole bridge away and you make it so you have no nose. You
Yeah,
take out the part that's offensive or excessive.
yeah,
When you do a buccal fat extraction, you don't remove all the buccal fat. You remove the amount that's excessive, and you retain a certain amount. It's like liposuction. You don't strip
yeah.
somebody
No,
until they are like skin on
exactly.
muscle. You need to know how much to remove and what
Yeah,
to retain, and in there lies the beauty of the procedure.
yeah,
So for buccal fat removals, people are afraid because they feel like if you take away too much, you'll look cadaveric or
yeah.
gaunt. Well, that's true. So then what don't you do? You don't remove
You don't remove
excessive
all of it.
amounts of it. You leave the appropriate amount behind
Yeah,
to create the contour and the silhouette. It's no
yes,
different than what you do with fillers. It's
yeah,
leaving the right amount and the right
yeah.
tissues in the right place and
That's
adding
the
the right
art.
amounts of different. But we are artists.
Yeah,
This is the
that's the
thing. We
art.
are not technicians. We are
Yeah,
artists at the end of
yeah,
the
yeah.
day, and the
It's a
difference in
judgment.
outcomes is that.
It's a judgment thing.
Yeah,
The last thing I want to mention, because you're one of the few doctors I know where I've just consistently seen really amazing results from, and I know it's a controversial thing, and that's the lip lift. I have to
yeah,
tell you,
yeah,
before I met you, I would, when people ask me about it, I'd be like, never seen really great results, not a
yeah,
great thing, bad
yeah,
scar. You
yeah.
you changed my mind on that.
Yeah, but here's the thing: is that it can be done very poorly,
Yeah.
unfortunately. And the thing is, the lip lift for me is not a new thing, but it's gained a lot of traction in social media, and there are tons of people out there doing it. It's really funny because the guys who are most active with lip lifts are actually people that I train because I do fellowship. I have a fellowship, and I've been training fellows for over 12 years now. So a lot of the guys who are out there like pumping this procedure, out there and really getting it out there are some of my disciples. But the
Yeah.
thing is that these procedures, again, it's like anything. It's a matter of degree. It's a matter of knowing. It's knowing what to leave behind and what to
Yeah.
take.
Yeah.
But it also has to do with the technique of the procedure. Because most people have performed like, 5 in a career. You can imagine how number 6 turns
Oh,
out. It looks like crap.
yeah.
I,
Yeah.
I've done over 1,500 lip lifts, so I
Who's a
don't.
good, like, what's a good candidate? It's not
Yeah.
just because you have an elongated filter,
No,
right?
it's not that for sure. But especially because I do aging face surgery, part of
Yeah.
aging, unfortunately, is our face
Absolutely.
groups. But
Yeah.
not only does our face droop, our lip elongates. And one of the solutions traditionally for that was to create longer veneers to be able to make the teeth pop out from where the lip is. But instead of doing that, what you do is you actually shorten the lip because it became longer. So it's not a lot, and so you don't do a huge lip lift, but it's just like what you said. You do a facelift, and then the area around here doesn't look right with lines and problems. Similarly, if you lift the face and you leave the lip long, it can make the patient look simian or somewhat monkey-like. And
Yeah.
it depends on your age. But
Yeah.
I'm not a big fan of doing lip lifts in young people. There are guys
Right.
out there that are doing lip lifts on 20-year-olds and stuff like that. I think
No,
that
no.
looks
Well, they're
somewhat
doing it because they
contrived and
want lip
crazy.
aversion. They
Yeah,
want lip aversion.
yeah. But I do think that those can look a little bit, a little bit
No,
weird. And it
they
doesn't
look
now
weird.
that it's not to say that I've never done a lip lift on a younger person, but I'm much more selective about who I do it, because it's an irreversible procedure. Here's the
Yeah.
important thing that people need to understand, is that once you overdo a lip lift, you can't put it back.
Yeah.
So I see a lot of people, because I do a lot of them in revision consultation, who've had an overly aggressive lip lift, but their options for repair are none, because you can't like put a skin graft and drop the lip back down.
Yeah.
So that's
Well,
why it's extremely important.
This is a good point to mention. Not only are surgeons seeing younger and younger patients, but as a dermatologist, 1/3 of the patients that come to myself or the providers in my practice at PFRANKMD are under 30 now. It's really unbelievable. And it doesn't mean I'm doing Botox on, or fillers or lasers on people who don't need it, but the aging process starts at like 21. I got people who went to college in Arizona and they got brown spots all over their face.
Or they went to Boulder, Colorado, and they were skiers. I mean, the amount of like actinic damage they have because they're outdoors people. It depends on your lifestyle, you know, and genetics. Some people have really bad genetics, unfortunately. Some people, they look 10 years their senior and they're very young, but nobody wants to look. You could be 25, but if you're 25 looking 35, you're not going to be happy.
Absolutely. And the expectations are different, like you said. But the point here is that it used to be in the generation before us of physicians, you know, you waited till you were 60 or 70 and, you know, you kind of like pulled the skin and you did or you stuck some silicone or collagen in there. And the point you said before is that, which is so important, when you and I and great surgeons look at faces, they don't only think about what they could do now, they predict how they're going to age. When I'm doing fillers, I think about what I'm doing to the tensile strength of the skin. When I'm resurfacing people, there are certain things I'll do on people, but it has to be at a certain stage of their life. I actually still use quite a bit of silicone in my practice. My mentors, Orange Reich and Berger, I use them a lot for acne scars. I'll occasionally use them for traumatic or aesthetic reasons. I have to think about what they're going to look like in 20 years.
Yeah, of course.
And that's what you were saying about the lip lift.
Yeah, and it's about, but it should be about all the procedures that we're doing. And here's the thing, we're held to a much higher standard than the rest of the aesthetic world, because you can't hide your face, right? So the thing is that if you do a procedure on a body or something like that, and you know it's not perfect or things don't age as well, you get a big pass. On the face, every little irregularity screams, right? So like if things don't
or
age
the patient
well,
screams,
or both. So you know you have to, and we're lucky, right? Because we're at a time of aesthetic medicine right now where we've seen the mistakes that were made before. Like the guys that were doing this 20-30 years ago, they didn't have the luxury of knowing what they were doing and how it could go wrong. We're lucky because we've been able to see a lot of treatments come and go. And now we say, you know what, if I'm going to do this, I have to be sure that that's not going to happen, because that happened with X product or with this device or with this surgical treatment.
But you know what? There's more abuse than ever now. There's more abuse than ever.
Yeah, but I think that's because, and this is the thing. This is where I think at the end of the day, it comes down to the, you know, you really have to know your doctor, because it's more than their technical ability. It's who they are as a person, not only how you get along with them.
Oh, absolutely.
But, you know, a lot of people will profiteer and don't care. Like, and it's horrible, but, you know, people will find an opportunity to make some extra money as long as they could get somebody to sign on board and make the transaction. They'll do more surgery. They'll do more filler. They'll do more whatever. And, you know, that's why you need to find a practitioner who has good ethics and really genuinely is passionate about what they do and cares about their patients to say to you, if it's time, no, you have to be able to say no. You need to tell the patient more surgery is not right. More of X, Y, Z is not right. This is where you need, you know, this is where you're going to go wrong. And, you know, instead of, you know, just going down that road and being like, oh, okay, I'll do another procedure on them. It helps me, and you know, financially or otherwise. But that's why you have to do a lot of research and homework as a patient, and you have to really have a good sense of your gut. You know, you have to, when you're in front of that practitioner, if there's something about it inside that says something's not right here, I always tell patients, if your gut tells you that this isn't the right place, don't stay. You have to go with your gut.
Yeah. Well, my friend, I think that about says it all. We've told everybody in the world that they have to choose us. So no.
No, we didn't.
No,
we didn't say that at all. What we said is that if we're a good fit, we're excited to take care of you.
That's really it. There are a lot of us out there.
There are a lot of other good providers out there.
Yeah, that's right. Yeah. Anyway, it was a pleasure to speak to you. I'm going to be watching you online.
Yeah,
okay?
I'll let you put as well, brother.
Okay.
I can't wait till we can spend some time together in
I
person.
know.
Yeah.
It'll come soon enough, my friend. Be well, be healthy,
Yeah,
and I'll
you
see you
too.
back at work.
Okay.
I'll
Be
see you
well.
later.
All right,
See you
be well.
later, everybody.
Bye bye.